Hey guys, let us quickly revise the cervical lymph nodes. So they are divided into superficial and deep. Superficial are present along the external jugular vein, deep are present along the internal jugular vein. Superficial are present on top of sternocleidomastoid, deep are present deeper to sternocleidomastoid. So superficial includes preauricular, postauricular, mastoid and occipital group of lymph nodes. Let us talk about deep ones. So for remembering the deep ones, you need to know certain landmarks. So the first, we'll talk about muscular landmarks, that is anterior belly of digastric, posterior belly of digastric, omohyoid, sternocleidomastoid, and trapezius. So once again, you see anterior bellies of digastric, posterior belly of digastric, omohyoid, sternocleidomastoid, and trapezius. Clear? Then we need to know lower border of hyoid bone, lower border of cricoid cartilage, and clavicle. Now, one group of lymph nodes we'll talk about divided into 1A and 1B. 1A is present between the anterior bellies of digastric. 1B is present between the anterior and posterior belly of digastric. This is 1A is known as submental, 1B is known as submandibular because submandibular gland lies here. Now let us talk about 2. So 2 is present from the base of the skull to the lower border of hyoid bone, if you can see. So from the base of the skull to the lower border of hyoid bone. And 3 is present from the lower border of hyoid bone to the lower border of cricoid cartilage. 4 is present from the lower border of cricoid cartilage till the clavicle. So 2, 3 and 4 all lie in the same line behind the sternocleidomastoid along the internal jugular vein. Now 2 is divided into 2A and 2B by spinal accessory nerve. So spinal accessory nerve which supplies the trapezius. So 2A lies anterior to spinal accessory, 2B lies posterior to spinal accessory. Group number 2 is also known as jugular digastric. 3 is also known as jugulo-omohyoid and fourth group of lymph node. Remember group number 5 lies and is bounded anteriorly by sternocleidomastoid, posteriorly by trapezius, and inferiorly by clavicle. It is also divided into 5A and 5B by omohyoid muscle. So this muscle is omohyoid, which divides it into 5A and 5B. Remember, 5A is posterior triangle, so it drains the posterior triangle group of lymph node structures. Now, group number 6, which is also known as the anterior or the central compartment lymph nodes. It drains the central compartment, so which includes trachea and the parts of larynx, along with the thyroid cartilage. So pretracheal, paratracheal, prelaryngeal. Prelaryngeal is also known as the Delphian group of lymph nodes, which drain all of these. So remember, any malignancy associated with thyroid or larynx would be affecting group number 6. So we need to remove group number 6 lymph nodes in these cancers. Group number 7 is also known as upper mediastinal, which drains the upper mediastinal group of lymph nodes. So remember, why are we studying all this? Because different structures present in the head and neck, from your oral cavity to your tongue to your nose, nasopharynx, and your thyroid cartilage, along with the other structures involved, the cancer of these structures, the most important route of spread is by the lymphatic system. So they would metastasize by the lymph nodes that are present. So we need to remove these lymph nodes when these malignancies are suspected. So this is a table. You can make a look of what group of lymph nodes are draining what structures.